Okay, so we'll start inshallah akhi.
Bismillah. We are on YouTube now.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Jazakumullah khair. This is the sixth series in the FIMA project which we are doing for the history of Islamic medicine, mashallah. And we have quite great doctors today with us, Dr. Zafer Wafai, Professor Wafai. I think most of you probably maybe know him. He's a very well-known figure in the ophthalmology. Dr. Zafer Wafai, mashallah, I know he looks quite young. He's 84. He's been graduated from Aleppo, from Syria, from the Faculty of Medicine in 1967. Started his training in Syria in ophthalmology for a couple of years, and then he moved to the state, to America, to continue his training in ophthalmology. He spent most of his time in Boston, in the ophthalmology department in Harvard Medical School, almost between 1977 till 83. And then he moved and worked as associate professor in King Saud University in Saudi Arabia between 85 and 92. He worked in different places, even in America, and he established the Wafai Center for Ophthalmology in Damascus. Dr. Zafer Wafai, he wrote quite a few books, mashallah, and articles in both in ophthalmology as well as in the history of Islamic medicine, particularly in the history of ophthalmology. I think I'll probably maybe leave it now to him if he wants to start, and inshallah we'll be having a quite a good time, around 45-50 minutes, and then inshallah will be a session for question and answer. Jazakumullah khair. Okay, akhi Abu Ayman.
السلام عليكم. بسم الله الرحمن الرحيم. ربي أوزعني أن أشكر نعمتك التي أنعمت علي وعلى والدي وأن أعمل صالحا ترضاه وأصلح لي في ذريتي إني تبت إليك وأنا من المسلمين. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. In the name of Allah, the most merciful, the most compassionate, may God grant me the grace that I may thank you for the favors which you have bestowed upon me and my parents, and that I may do good deeds that will please you, and grant me good children. Surely I turn to you in repentance, and surely I am one of those who are Muslims. Ladies and gentlemen, first and foremost, I would like to extend my many thanks and sincere appreciation to our friend, brother, and colleague, Dr. Sharif Al-Ghazal, who is Professor Sharif Al-Ghazal, who gave me the honor, pleasure, and privilege to share with you my humble experience and knowledge in the field of contributions of Muslim ophthalmologists and oculists in the development of ophthalmology. As we all know, Professor Sharif Al-Ghazal is very active in professional organizations involved in the history of medicine, HIM, Islamic medicine, and the organizations involved in the foundation of Islamic Medicine Medical Association, HIM-FIMA, in addition to other foundations and organizations. The title of the presentation, as you can see, is the contributions of...
We don't get your slides, by the way, Dr. Zafer.
Now,
We can't see the other slide. It's still on the first slide, by the way. So you may need to move the slide one by one. Sorry.
we are doing that one by one.
Yeah. No, I think you have probably maybe the slideshow, but we don't have a slideshow. We have it still as individual one by one.
Okay.
Sorry.
I'll try. You can keep reading. I'll try to share again.
The title of the presentation, as you can see, is the contributions of Muslim ophthalmologists and oculists in the development of ophthalmology. But I choose not to limit my presentation to ophthalmology only in an effort to engage more of today's audience. For that reason, I will include other fields of sciences where the Muslims played a great role, each of his own in his own field, with an emphasis on the field of my passion, the history of ophthalmology, in which I have spent more than half of my career as ophthalmologist, 44 years, collecting more than collecting many manuscripts or microfilms from libraries in the Middle East, North Africa, United States of America, Pakistan, and India. With the help of Allah, I was able to edit, update, and publish just about all of those books about ophthalmology. Ladies and gentlemen, we were made to believe that whatever comes from the West is absolute, and whatever comes from the East is obsolete. For this reason, if this is the case, then let me quote the late Professor Julius Hirschberg, the most famous ophthalmic historian of all time, in the last part of the second volume of his encyclopedia, Geschichte der Augenheilkunde.
We're not moving the slide. You're not moving the slide, Dr. Zafer. That's it. That's it.
That means we cannot do full screen.
No, because you haven't shared the full screen. So you need to move it manually. I'm sorry.
Yeah, that's okay. Thank you. And the last part of
the Arabs held high the torch of medical science in all parts of the Islamic world, from the river Oxus to the Guadalquivir. And he adds, the European ophthalmologists of the Middle Ages had no other teachers than the Arabians. This book was translated recently into English by the late Professor Frederick C. Brody, and I had the honor of reviewing and editing the English version, published in 1985 in Germany. I would like to divide this presentation into 3 parts. Part number 1, the ophthalmology books written by oculists, by ophthalmologists also, which amounts to about 25 books. Category number 2, the books in general medicine, but containing chapters about the eye diseases and their valuable management, which amount to 8 books. Category number 3, some very important and valuable inventions by Muslims, scholars. If any of you would like to, the antique Greek Hellenistic word are for us the source of all sciences, but the Arabian civilization was its conduit. If any of you would like to extend his knowledge about the history of ophthalmology, I would like to advise you to try to find this book from his publisher in Lebanon, Dar al-Nafais, because this is really mini encyclopedia about the ophthalmology. Let me start from the oldest person and coming up to the Jibra'il ibn Bakht Yeshua ibn Georges. He wrote one small letter. The name is a treatise about the optic nerve. This cannot be considered as a book, but because of Hirschberg and Professor Fuad Sazgin put them in their books, I would consider it. It's very small. It's about 6 or 7 pages. I didn't want to edit it because it's not worth it. Number 2, Johanna ibn Masawi, in Latin, Janus Damascenus, who wrote two books, Daghal al-Ain, the alteration of the eye, and the Ma'rifat Mahnat al-Kahalin, السؤال والجواب, knowing the ophthalmology profession in question and answers. And lately, the late Professor Nashat Hawarni passed away in Jordan in his hometown, and published this book finally. We were waiting this book for about 20 years, but thank God it came out finally. Number 3, Hunayn ibn Ishaq al-Abadi. He is the establisher and the founder of Bayt al-Hikmah during the Ma'mun dynasty. He wrote many books, but the most important one was Al-Ashar Maqalat al-Ain. This book is considered the very first academic book on ophthalmology. The others are small ones, don't even need to be. He rejected the mechanism of vision by Galen, and 2 theories rejected also by Empedocles and Epicurus. This is a cover of the Ashar Maqalat fil Ain, and this book, I'm so proud to say that I have it in my library, and it has no value. Nobody can put any value. Why? Because Max Meyerhoff himself, who translated that into English and edited this book, really signed it to his friend in Egypt, and I have this copy. This is the very first book in the history of mankind to contain a photo or drawing of the eye and its adnexa, such as the extraocular muscles and the muscles, the optic nerve, as you can see, with the chiasm. Thabit al-Harrani, he was not only ophthalmologist, he was mathematician, he was astrologist, he was a super intelligent person, but he wrote a book, very small book, by the name Al-Basar wa Basira. This book is very small, but I put it in one volume with the other book, which is كتاب عمار بن علي الموصلي, under the name of المنتخب في علم العين. Contribution, the most important contribution of Thabit is the treatment of the amblyopia by covering the good eye in order to force the light to go into the bad vision, bad eye. This is the book between البصر والبصيرة لثابت ابن القرن الحراني والمنتخب في علم العين لعمار بن علي الموصلي. Professor Hirschberg and Professor Mitvor and Lepert translated those three books, this book, I'm sorry, into German. And we were able to translate them into English and publish them in English in Saudi Arabia in 1990. Ali ibn Isa al-Kahal al-Baghdadi, he is the one who wrote a book which is considered perfect academic book that is not written of its style by any other person before him. What I'm talking about is the way he organized this book into chapters, sub-chapters, just about every picture in it written in the book. This is a cover of this book to تذكرة الكحالين, which was translated into English by Casey Wood. It was published in 1936 in Chicago. I have a copy of this manuscript and a copy of a microfilm of the copy in California. Ali ibn Ibrahim ibn Yeshua al-Kafratabi. He is he wrote one book by the name تشريح العين وأشكالها ومداواة أعلالها. This is the very first book in the history of mankind to be specialized in the anatomy of the eye, nothing but anatomy of the eye, and the few diseases he put them just to make the book more interesting. And this book was completely forgotten in the history until Max Meyerhoff mentioned that in the introduction to his book, 10 Treatises of the Eye, and he put it as one of his references. When I found that in Max Meyerhoff's book, I really worked very hard to get this microfilm copy from Egypt. Muhammad ibn Qassum ibn Aslam al-Ghafiqi, he is from Spain, wrote one book by the name The Guide to Ophthalmology. This is considered as a book about pharmacopoeia, meaning he mentioned 500 simple medications useful and helpful in treating the eyes, and 59 compound medication prescriptions, in addition to 13 surgical instruments, and explained the concept of refractive error. This is the book that I received from Al-Ghazal al-Malakiyya, the royal closet in Rabat, in Morocco. The book was edited and published in Saudi Arabia in 1990. Abdullah ibn Qasim al-Hariri al-Ishbili. I did not have a chance to edit this book because it was edited in Baghdad by the two professors, Professor Sharif al-Hani and Professor okay, okay, we'll go back to one more slide. This is Abu Abbas Ahmad ibn Uthman ibn Hibatullah al-Qaisi, who lived in Baghdad and wrote a book, very small book, not much, about maybe 100 pages. نتيجة الفكر في علاج أمراض البصر. The final thoughts about the treatment of the eye disease. This is the jewel of my library. If I don't have any books at all about the history of ophthalmology except this one here, I will be grateful to Allah I was able to do it. This book is unknown to many people, to many historians. It was mentioned in the list of Max Meyerhof, but we couldn't find it. So I kept on looking until I found one by accident, by accident in Istanbul, in Yani Jami library. Look, I want you to keep an eye on this drawing. If this drawing, if there was nothing but this drawing in this book, it will be worth all the history of medicine, of ophthalmology. This book was published, edited and published, Al-Kafi fil Kuhl, and this drawing was so good to the degree that the American Academy of Ophthalmology in 1987 took this drawing and destroyed it. Unfortunately, damaged it, and they put it as their emblem to their meeting in Dallas, Texas. When I asked the late Professor Blody, where did he get this drawing from? He told me, I don't know. He was at that time the president of the academy. So I don't know, maybe it's artistic conception. So I wrote him a letter from Saudi Arabia with the right picture and the correct legend. And I told him, enclosed, please find the correct picture and the right legend, but please next time when you steal something, don't destroy it. Of course, I don't hear anything from him ever since. This 2.5 pages contains a drawing of 36 surgical instruments. Each one of them has its name on the top and how it's used in the bottom of the instruments. 36 surgical instruments. Each one of them was drawn and manufactured and used by Khalifa ibn Abi Mahasin al-Halabi. This is 2 pages from the Paris library. I spent 3-4 days in the Paris library trying to obtain microfilm or a copy of those photos, because they would not allow anybody to touch any manuscript over there. Ibn al-Nafis, we all know Ibn al-Nafis is the discoverer of the lesser circulation of the heart, meaning the circulation between the heart and the lungs. But nobody knew that he was ophthalmologist and he had a book on ophthalmology until I discovered this book by mere accident sometime in Cairo. This was in Cairo, where I was able to bribe the librarian and to get me microfilm of this book. The book was translated, it was edited, and was published in Rabat, Morocco. Salah ad-Din al-Hamwi. That's will please Professor Sharif Al-Ghazal, because this man is from Hama. This book is like an encyclopedia of its time. The reason for that, he summarized just about every book written before him, and especially it contains the most important colored drawing of the globe, cross-section of the globe. And we published this book in 1987 in Saudi Arabia. Ibn al-Akfani, Abu Abdullah, Muhammad ibn Ibrahim, ibn Sa'id, ibn Sa'id al-Ansari al-Sinjari, wrote a book about كشف الرين في أحوال العين, uncovering the disorder of the eyes. The book is really not that fancy, not that very important, because it doesn't bring anything new. No new inventions, no new instruments, no new surgeries. But it's very, at least the man did his best. This is the very last book in the history of ophthalmology in its golden age. The name is Al-Umda al-Kuhliya fi al-Amrad al-Basariyya. I tried to find some kind of translation. I couldn't. The author wrote this book, which was really summarized just about every book written before him. That's why it came out to 600 pages. We were able to edit this book and publish it in Beirut, in Dar al-Nafais. Let's go now to part 2, books in general medicine, which contains chapters about eye diseases and their valuable management. Number 1, Ali ibn Sahel Rabban al-Tabari. I intended to put those two books into one volume. Why? Because Hirschberg said that Ali ibn Sahel Rabban al-Tabari did not write anything about ophthalmology. So I brought his book, Firdaus al-Hikmah, and find out and get out or extracted everything written about ophthalmology. That's why I put it in with another book later on, and you will see it in a few seconds. Al-Razi of Muhammad ibn Zakaria al-Razi, Abu Bakr, we all know him. He is the prince of physicians. His book is Al-Qanun, and he wrote about everything, and he had several chapters in his book about I'm sorry, not Al-Qanun. His book,
حاوي في الطب.
الرازي في الحاوي في الطب. The name of the book, Al-Hawi, the continents of Al-Hawi al-Tab. It's a big encyclopedia, about 20 volumes, but I was able to get to extract the parts of ophthalmology and put them in one volume, which is really good. Abu al-Hasan Ahmad ibn Muhammad al-Tabari. This is the second Tabari, and that really corrected what Professor Meyerhoff erred in this when he stated that Ali ibn Sahl al-Tabari did not write in ophthalmology. So I put both of those books, معالجات البقراطية وفردوس الحكمة, in one volume, and was published in by Al-Furqan institution in London. Ali ibn Abbas al-Ahwazi. Many people say al-Ahwazi, but actually it's al-Ahwazi, because al-Ahwaz is part of the Arabian land, and he wrote a very large book about al-Kihala, about كامل الصناعة الطبية, about general medicine, but there is big chapter about the Kihala, about the ophthalmology in this book, which I extracted and put it in one volume and was published. Abu al-Qasim Khalaf ibn Abbas al-Zahrawi. He is from Spain, the very first known surgeon or recognized surgeon of modern surgery in the history of mankind. He invented many surgical instruments, starting with the fetal forceps and the use of the catgut like a thread to suture the wounds, among everything else, in addition to the sure. But anyway, so he is the first one to be recognized as the first general surgeon or surgery in the history of mankind. Those are only some of the instruments that he invented and made and used in his surgery. Abu Ali al-Hussein ibn Abdullah al-Hussein ibn Ali ibn Sina. We all know Ibn Sina. He is one of the famous, between him and the Razi. We really, he wrote a book, Al-Qanun. But as you notice that most of those guys are not Arabs, but they are Muslims, and they wrote all their books in English language. So finally, I was able to get some of the ophthalmology written about only in his book Al-Qanun and put them in one volume and publish it in Dar al-Nafais in Beirut. Al-Hasan ibn Haytham, who doesn't know him? Al-Hasan ibn Haytham is the man who thought he will be able to build the dam, Aswan, in Egypt, in the Upper Egypt. But when he studied that dam and what damage it can affect the cultural and the environmental in Egypt, he gave up, and he claimed that he lost his memory and his books, and he lived next to Al-Azhar mosque in Egypt, where he put the principle of al-basariyat, the optics. He is the founder of camera, that's the one. The small hole in the one of the walls of the box, and the rays will go inside and be converted on the other side of the box. Let's go back to part 3. Those are important and valuable inventions by Muslim scholars. This is very small printing, but unfortunately I couldn't enlarge it to make it easy for you. Ibn Khaldun is the founder of sociology. Al-Qazwini is the first one to talk about the الأرصاد الجوية. What do you call that in English? الأرصاد الجوية, the weather predictions. Al-Kindi, he was the first one to be able to فك الرموز, شفرة. Al-Jazri, he is the first one to talk about robotic instruments. Ibn al-Haytham, al-Basriyat, Thabit ibn Khur al-Harrani, we spoke about him earlier. Ibn Batlan, التفاضل والتكامل. I couldn't find the English meaning of that or the translation. Al-Kahal, everybody is Al-Kahal. Anybody who works with ophthalmology is Kahal. Ibn al-Bitar, he is the founder of the science of botany and pharmacopoeia. Al-Zarawi, founder of the modern general surgery, and Al-Khwarizmi is the founder of logarithm, and that's what they call it, Khwarizmi or logarithm. And Abu al-Aswad Du'ali, he talked about HIM-FIMA. From this retrospective historical evaluation, we have to recognize that ophthalmology, the contributions of ophthalmology, the Arabian contribution to ophthalmology are permanent and will forever be engraved in the book of history. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله وبركاته. أخي جزاك الله خير. Very good. بارك الله فيك. Just very quick question. I'm just waiting for the other brothers and sisters to put some any question they want to do. But just from the looking at when Ammar al-Musalli and Ali bin Isa al-Kahal al-Baghdadi, both of them actually from Iraq, both of them died almost like in 1010, in 1010. So very similar to Al-Zahrawi, who died, I believe, in 1013. The question is, Akhi, I was reading Al-Zahrawi. I was got great interest Al-Zahrawi, and you know, he's, as you quite clearly said, the father of surgery in the continent, in Europe, because he was born in Spain. And he was talking about the cataract. Very fascinating way he invented and he made they call it al-miqdah, the little instrument to do the cataract. And he talked in a very good details about the cataract, but he stopped short when he said, look, he tried to be very honest, said, look, I heard people coming from Iraq, they treat the cataract, الماء البيضاء أو الماء الزرقاء, they call it the cataract, by using the suction technique. he didn't explain any much. I found it very interesting for somebody, number one, to although he's an encyclopedia in surgery, mashallah. So he described this technique and stopped because he never used it. So he gave the credit to the people in Iraq, but there's no reference who invented it. So is that true, Akhi? Looking at what the cataracts, probably simplest, one of the simplest operations they do, any ophthalmologist. I'm a plastic surgeon, I'm not ophthalmology, but I believe they do it nowadays, even under local anesthetic. So has it been practiced, which is 1,000 years ago, even by different techniques, mashallah? Can you please maybe shed a bit light, Dr. Zafer, on this, the techniques they use for cataract? And the way Iraqi people and the Al-Zahrawi.
The Al-Maqdah is known from really eternity almost, a long time ago. But it was like a needle with dull head. So they go in with a sharp needle, and then they put the Maqdah on top of the cataract and dislocated down into the vitreous cavity. Unfortunately, this procedure was very dangerous because it will implant so many bacteria when they are going in and out of the eye. But the one who invented the al-Maqdah al-Mujawwaf, the hollow couching needle, was Ammar ibn al-Mawsili in Iraq, from Mosul. And what he did is to bring, to take a very fine tube, make small, tiny incision at the limbus, which is the junction between the cornea and the sclera, and introduce this tube and order his servant or his assistant to aspirate. And he is watching how much he can aspirate. And he put two indications for that, which are very important. Number one, the cataract should be soft, meaning either traumatic, somebody get hit on the eye yesterday or the first day, and he came to the hospital, we can do it, aspiration. Or congenital cataract. Why? Because the nucleus is not solid yet. So we can aspirate the nucleus and the cortex all together. So it's Ammar ibn al-Mawsili is the one who invented that.
And I believe this technique being used till recently, maybe last 30, 40, 50 years ago?
At my case, I started my ophthalmology training in 1965, 60 years ago. We used to make 180 degrees opening on the limbus and flip the cornea, and we introduce a forceps to remove, to grab the cataract and try to get it out intact. Very frequently, we used to lose the capsule, and sometimes we lose the nucleus inside the eye. But until they started using in 1973, 74, started using the intraocular lens. But it used to be anterior chamber intraocular lens. They removed the cataract completely, including the capsule and nucleus and the cortex, and they put the intraocular lens in front of the iris, which usually, in this case, it damaged the cornea, and frequently the eye is lost. And then the techniques start improving gradually until now we have the aspiration and emulsification. They just go in with a small, tiny 1.3 millimeters incision and they put the phacoemulsification. They emulsify the nucleus, and they aspirate it.
So can we claim that people like Ammar Musalli or Ali Isa al-Kahal Baghdadi, or even the gentleman from Aleppo, Khalifa bin Abi Mahasin Halabi, or even the Hamwi Salah ad-Din al-Kahal, so can we say that they put the foundation for the science of ophthalmology? And if you say yes, what sort of contributions to the current modern ophthalmology they did?
It's zillions of contributions, zillions. If you want about anatomy, they made so much drawing about the anatomy. If you want about physiology, they discussed the optics of the eye with very, 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 very fine details. If you want about medications or botany, they use the 3 types of medications from the plants, from the minerals, and from the animals. So, yeah, they introduced many things, plus the surgery. The surgery, they really modified the surgery hundreds of times. I wish if you can read one of those books, the Salah ad-Din al-Hamwi. He talks about how the surgeon should wear, what kind of clothes, where should he put the patient's head, on his lap or on his knee, and which is the direction of the sun. So precise. Each step is so precise.
Any questions? People are here. We've got Professor Hassan Fadil, Dr. Majid Qatmi, and anybody would like to add a question or put questions or any comment? Barakallah feek, akhi. Anything you want to add? We can close for the meeting.
Not really, but all I hope is that our new generation doesn't get drifted with the new technology and forget about our heritage, our past, because they really added. And as you noticed, Hirschberg said that without this bridge between the Byzantine and Grecian and Persian civilizations and the Renaissance, this bridge 600 years old. Very important thing I want to mention. Correct. That George Sarton used to be, before he died, the chief of the Department of the History of Medicine at Harvard of Sciences, the History of Sciences in Harvard University. He started writing his book, Introduction to the History of Sciences. He finished the first book, chapter, or the first volume on antiquity. And then he came to the Islamic era. When he started writing this book, this volume, he was advised by his allegedly friends, don't talk about those Muslims. They are just nothing. They didn't do anything. They was just translated few books, and that's the end of it. He told them, what do you mean translated few books? Without them, we would have no Renaissance in Europe. It would have been so, it would be delayed. Like, and after that, he allowed, if you happen to go to Boston one of those days, please go to the Harvard yard, not Harvard Square, Harvard yard. You will see a huge building, almost as big as the Library of the Congress, and that's George Sarton's library. He lost his house. He lost his position at Harvard. He lost his library, and when he died, his daughter went around. Not too far ago, 1948, 49. She went around for to collect some money from his friends for the burial.
Jazakallah khair. We've got one announcement. I'm going to leave it later on to Dr. Abdurrahman, our admin. I've got two questions from Dr. Abdul-Majid Qatmi and from Professor Hussam, Father. Dr. Abdul-Majid, I think you raised your hand first. Please feel free.
Assalamu alaikum wa rahmatullah. Can you hear me?
Yeah,
Yes,
yeah,
we
yeah.
can. Yes, we
Can you hear me?
Yeah, yes,
Yes,
yes, yes.
yeah.
We can.
Oh, Jazakallah khair. Shukran. Barakallah feek, Dr. Sharif, for your good activity in the history of medicine and other. Now, obviously, mainly I have few comments, if you don't mind. I get more frustrated and angry myself when I discover so different talk, Islamic medicine, history of Islamic medicine, how much I am ignorant, how much we Muslim doctors, 99.9%, are ignorant of the great Islamic medical civilization. I feel strongly this should go in the medical curriculum in Muslim medical school to orient people about it. I believe a lot different specialty should be used for da'wah. Let's get conference of all eye specialists here in UK. If many are welcoming, they love to know the other view. In fact, we need to do it first to our own Muslim doctor, our own Muslim ophthalmologist, So we should utilize that. I put this idea to my great friend and teacher, Dr. Salim Al-Hassani. There should be exhibition in every hospital in United Kingdom and every country in medical school and hospital. People will love to know that this great Islamic medical civilization is hidden from most Muslim doctors and hidden more from non-Muslim. So I think we need to utilize. We are proud of history, but what are we doing for today? This is another aspect. There is no invention I see in all the world. There is no thing to be proud to talk about it. Now, finally, my small point, this will need, I don't know the doctor if is able. The Quran is so precise in choosing the word for meaning in ayat, Now, it occurred to me, in the Quran, there is ra'a, there is another one, basara, there is another one, nazara, 3-4 words related to the eye to see. I love somebody who can enlighten us, if the Dr. Zafer can help us in this, to find this great evidence with ayat and word. You think we all think the same, nazara, basara, etc. and ra'a. This is interesting, I feel, to add it to the miraculous selection from Allah to different words for different meaning. Now, the other thing, finally, I hope, you, Dr. Sharif, organize something for non-Muslim, the biggest talk for da'wah, to give a brief on all invention, discovery, Islamic medical. This will open the heart of people, open the heart of Muslim doctor, of non-Muslim doctor. We keeping it hidden for a long time. And we have a lot to offer, because the impression in the West, oh, these people backward, they don't know anything, they taken science from us, they taken medicine from us, etc. We should be proud to open out, take it out of the closet and to make some effort, inshallah. And I believe this is a way to invade in a nice way all people, all doctors in different specialty. It look our early Islamic medical civilization covered all specialty, and we can organize according to specialty. May Allah guide us on. And Jazakallah khair, Dr. Sharif and Dr. Zafer. Thank you.
Jazakallah khair. Do you want to take the other question from Professor Hussam, Zafer? And then
yeah, go ahead. Go ahead. But can I answer the brother?
Okay, fine. If you want to take one by one, that's fine.
Number one, about teaching the history of sciences. In 1984, I was asked to give the keynote speech of the Afro-Asian Congress of Ophthalmology in Islamabad. At that time, the president was Zia al-Haq. If you remember him, he passed away in an explosion. Anyway, and him and all his entourage, ministers and presidents of universities and everything else. So I gave a talk about that, the history of sciences. And I mentioned at the end of my talk, I said, I have a dream, just like Martin Luther King Jr. I have a dream to see the history of sciences on the curriculum of every medical, pharmaceutical, botanical, chemical, anything, school in the Muslim land. And I really hope that we will force this topic, into each of them. I don't know if you studied in Damascus, Dr. Sharif. We used to have the history of medicine by Dr. Shawkat Shabti, then by Dr. Burhan Al-Abid. So at that time, President Zia al-Haq came to I had putting exhibit at that time. He came to my exhibit and he said, your name was Dr. Wafai. Dr. Wafai, you motivated me more than anything else. And I promise you that as of next year, the history of sciences will be on the curriculum of every school. Take a look on engineering, architects, everything, astrology.
Sure.
This is number one. Number two, he was upset about the Ra'a or Basara. In Quran, there are no two مترادفات, كلمتين مترادفتين. None. Each one of them, each one of the words has different meaning that can go in different way. So don't be mad because of the thing. البصر غير البصيرة. You can see me, but you can't understand me. You can't go inside me. You can see me. Number three, about since he mentioned that he is a friend with Dr. Salim Al-Hassani, Abu Ahmed, it's very easy. You remember, I don't know if you remember, 5 years ago, we put a book together. I worked on this book, 1001 Cures.
Yeah, published already.
I reviewed this book. I tried my best to correct some of the false, not false, but incorrect statements. So you have 1001 invention book. They can have it from Dr. Hassan.
Jazakallah khair. Barakallah. Dr. Hussam, feel free. You're muted.
We can't hear you.
Okay, yeah, now I can speak.
Now you can. Now we can.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for all this presentation, Dr. Sharif. Very nice. And also I thank Dr. Zafer. It was very interesting the way that you collected, mashallah, so many old books in your own library, and you have seen that. So that was very good for me. But I have one little question, actually. I thought Ibn al-Haytham has much more than just the camera concept, quote unquote concept.
Obscura. Camera obscura.
Yeah.
Many
Can
things.
you add some more to his contributions, Ibn al-Haytham particularly?
I tried my best to limit myself to the time.
Kitab al-Manazir.
Yeah, anything more he talked about Ibn al-Haytham in the eye or the structure of the eye, or
If you want to read about Ibn Haytham, you can go to his book Al-Manazir, which was edited by late Professor Abdul Hamid Sabra, and was published in Kuwait. It's about 1,000 pages book, huge, about the contributions of Ibn Haytham.
okay.
He's more than genius.
Mhm.
He's more than genius. But as I said, I am limited to the time. Dr. Sharif told me, please limit your time to 45, 50 minutes. I don't want to exceed that.
I understand. Thank you.
Jazakallah khair. Dr. Abdurrahman, if you want to make a little final note, Akhi. We're trying to organize the admin side.
Jazakallah khairan, barakallah fikum. So coming back to one of the comments from one of the doctor about spreading the word of these amazing talks that we held at HIM-FIMA. So one of the way is spreading the word by subscribing to our YouTube channel and share the word with everybody out there who is interested. We have just established a new WhatsApp group. I did share it in the comment. I'll share it again now. Sorry, excuse me. So if you're interested to know any future events, would like to attend, you can join this group. I did send it right now. You can join this group, and we promise you only admins can post, so it's not random. It's not any days and time, so it'll be only relevant to the project that we held in HIM-FIMA, inshallah. Jazakumullahu khairan, and thank you, Dr. Zafer, mashallah, amazing talk. Barakallah feek.
Barakallah. Jazakallah khair. Barakallah feek.
Thank you.
MashaAllah. Jazakallah khair. Zafer.
أهلا وسهلا.
See you, inshallah. Assalamu
أبو زكي. سلم.
Jazakallah khair. Thanks very much, everyone. Thank you. Bye-bye.